Well, with more than 1.3 million confirmed cases of the novel coronavirus across the globe and the virus accounting for more than 73,000 deaths, Health Minister Dr. Dwayne Sands has implored Bahamians to take the threat of the virus more seriously and take steps to protect themselves and others. He says the virus threatens to leave deep wounds socially and economically, noting that the world is in uncharted territory and the Bahamas is not exempt. Cleopatra Murphy has more.
The Bahamas has recorded 29 cases of the novel coronavirus in under a month, and among them 5 deaths, with a case fatality rate of 17.2%. Minister of Health, the Honorable Dr. Dwayne Sands, shared the statistics in Parliament Monday, where he warned that if the rate of infection were to continue at this pace, the country's healthcare system could become overwhelmed. He says only through social distancing and hand washing can the Bahamas defeat the virus.
Last week, the Prime Minister told the Bahamian people that he wanted all Bahamians to live and that he wanted to live. Mr. Speaker, I also want to live. But already, we have lost 5 of our citizens. These citizens are fathers, mothers, daughters, aunts, and uncles. And these untimely deaths have left an unforgettable void in our country.
23 cases of the virus have been recorded in New Providence, 5 on Grand Bahama and 1 on Bimini. The minister says 11 cases remain hospitalized, with 3 very ill. He says the 5 deceased were among the group considered vulnerable, ranging in age from 57 to 80. Sands says contact tracing continues and more than 300 contacts of patients diagnosed have been identified by the surveillance team.
What we know is that 52% of the cases are persons aged 40 to 59. Male to female ratio is 1 to 1. There's only 1 imported case and 3 imported related cases. The rest are due to community transmission.
Sands says the way Bahamians socialize has contributed to the spread of COVID-19, adding that the Bahamas has yet to reach the peak. He says as those on the front line, healthcare workers are particularly vulnerable to the novel coronavirus.
Almost 1 in 5 of our cases, or 18%, have been healthcare workers. Among these confirmed patients, 2 have had to be hospitalized. And as we have heard tragically, 1 has died. What is more worrisome is that more than 50 healthcare workers have been identified as contacts of diagnosed or confirmed cases.
Sands says Bahamians must protect healthcare workers who also have families by staying at home. He says government is also exploring introducing rapid testing for the virus, having already completed more than 300 molecular tests.
A month ago, these tests would have had to be sent to Trinidad or to the CDC in the United States to be run. They are now run in the Bahamas. And within the next week, in spite of the world demand, we expect to have added equipment to duplicate our ability to provide PCR testing in country.
The Minister of Health says there are presently 10,000 rapid testing kits in the country, and once those have been verified, the Bahamas can begin wider screening at the community level. He says health officials are also exploring ways to acquire more personal protective equipment to ensure there is a consistent supply for medical professionals, noting that there are more than 1,000 cases of surgical masks and 44,000 N95 masks, with another 150,000 set to be delivered this week. Cleopatra Murphy, SAT&S Network News.